Welcome back to HealthTech Explorers. Today we will talk about how ChatGPT saves lives, real stories and reasons for success. Many people still think of ChatGPT as just a tool for casual conversation or quick information searches. But in reality, AI chatbots have already saved lives, both human and animal, by helping people recognize critical symptoms, request the right tests, and seek timely medical care. Today, we'll explore real-life cases, explain why ChatGPT and other AI chats can sometimes spot problems earlier than traditional healthcare systems, and show why patients and even doctors are increasingly relying on AI for second opinions and symptom analysis. Why do people turn to AI chats? AI chats offer something that traditional healthcare often cannot: unlimited patient conversation. There's no 15-minute time limit. People can describe all symptoms, ask endless questions, and even request step-by-step explanations, in plain English or even as if I were a 6-year-old. Emotional support and better communication. Many patients feel rushed or dismissed by doctors. ChatGPT helps organize symptoms into a clear summary, making it easier to advocate for tests or referrals. Critical red flag warnings. Users credit AI for recognizing when something sounds urgent. For example, chest pain, severe rashes, or abnormal lab results, and telling them to seek immediate care. Suggesting additional tests or second opinions. ChatGPT often recommends follow-ups like ultrasounds, MRIs, D-dimer tests, or thyroid panels that patients later confirmed as life-saving. Support with rare and overlooked conditions. After months of misdiagnoses, some patients finally got answers because ChatGPT suggested rare diseases doctors hadn't considered. Animal health assistance. Believe it or not, even pets have benefited when AI suggested tests that saved animals from unnecessary euthanasia or untreated illness. Mental health and chronic disease help. Patients with long-term illnesses say ChatGPT provided structure, explanations, and even emotional reassurance that made them feel less alone. Here are real cases from news reports, social media, and expert articles. Hashimoto's and thyroid cancer diagnosed thanks to ChatGPT. Lauren Bannon in the U.S. spent months being misdiagnosed with arthritis. ChatGPT suggested Hashimoto's thyroiditis. Doctors retested her thyroid, discovered cancer, and performed surgery, saving her life. Life-threatening preeclampsia in pregnancy. Natalia Tarian, 8 months pregnant, asked ChatGPT about jaw tightness. The AI warned her about possible blood pressure issues. Testing revealed critically high levels. Doctors diagnosed preeclampsia, performed an emergency delivery, and saved both mother and baby. Child diagnosed. After 17 doctors missed it, Courtney's 4-year-old son Alex suffered chronic pain. After 17 medical visits without answers, ChatGPT analyzed all symptoms and MRI notes, suggesting tethered cord syndrome, a rare condition later confirmed by neurosurgeons. Dog diagnosed with immune-mediated hemolytic anemia. Cooper used ChatGPT to interpret his border collie Sassy's blood tests after multiple vets failed to find the cause. The AI suggested IMHA, confirmed by another vet, saving the dog's life. Early Hodgkin lymphoma detection. Marley Garnreiter in France ignored ChatGPT's warning about possible lymphoma after night sweats and fatigue. Months later, tests confirmed the exact cancer ChatGPT flagged. Medication side effects identified in India. Shreya's mother had chronic cough and internal bleeding. ChatGPT identified a blood pressure medication ingredient known for these side effects. Doctors changed the prescription, and her mother began recovering almost immediately. Low platelet emergency cases. Several users described rashes and fatigue. ChatGPT urged emergency visits where critically low platelet counts were found, requiring transfusions that saved lives. Pulmonary embolism and rhabdomyolysis. Users with ongoing chest or muscle pain, dismissed by doctors, were told by ChatGPT to seek urgent care. Both conditions, life-threatening if untreated, were confirmed in hospitals. AI helped with mental health support. Patients with autoimmune diseases said ChatGPT helped track symptoms, break down complex test results, and even encourage them emotionally to keep seeking medical care. Cat saved from misdiagnosis. A pet owner was told to euthanize their cat due to blood clots. ChatGPT suggested checking blood pressure first. The real cause was found and treated, saving the cat's life. Why does this work? AI chats provide something healthcare often lacks: time. AI doesn't rush you. It analyzes everything you provide: symptoms, lab data, timelines, at your pace. Thoroughness. AI doesn't rely on cognitive shortcuts or assumptions. Education. AI explains results clearly, sometimes simplifying answers so even children can understand. Empowerment. Patients feel more prepared when discussing their cases with real doctors. Cross-specialty perspective. When you see a narrow specialist, their focus is naturally limited to their own field. For example, a patient with chronic abdominal pain might see a gastroenterologist who looks for digestive issues, while the real cause could be a spinal nerve problem. ChatGPT, however, considers symptoms from multiple angles at once, suggesting possible causes or tests from entirely different specialties that might otherwise be overlooked. This doesn't replace medical professionals, but it bridges the gap between symptoms and diagnosis, often prompting earlier interventions. Important cautions. AI should be used as a support tool, not a final authority. Always confirm AI suggestions with qualified healthcare professionals. Use AI for education, preparation, and communication, not self-diagnosis. Never share personally identifiable patient data with unsecured systems. ChatGPT and other AI chats have already changed how people approach their health. From saving pregnant mothers and children to diagnosing rare conditions and even helping pets, AI has proven its potential to assist, educate, and empower patients worldwide. The key is balance. AI offers time, analysis, and clarity, while real doctors provide physical exams, treatments, and final decisions. Together, they create a future where technology and medicine work hand in hand to save lives. Thanks for watching. If you liked the video, don't forget to give it a thumbs up and subscribe so you don't miss any future videos. See you next time.